Good morning, everybody. This is a beautiful morning. Sun is out again. We are here with the season 4 of What Would You Do? Today I would like to talk with you about a case that is quite multidisciplinary. It's a combined Prostho and Ortho. Ortho department guided by Dr. Elena Servino together with Dr. Maria and Dr. Mafalda. We asked you a question yesterday. What would you do in this case? What do we see in this case? Maybe at the first sight it looks like the girl is almost perfect, right? It's a 29-year-old woman with some orthodontic needs and some moderate teeth wear. And she came to us to find some aesthetic and functional adjustment. And we asked you, what would you do? Would you first make the reconstruction of the wear and then do the orthodontic treatment? Would you first do the ortho and then the reconstruction? Or would you go for PGO, which is Prostho-guided ortho and then reconstruction? What are the answers? So, 18% of you would first do the reconstruction and then the ortho. I think it would be quite difficult because when we have crowdings, it's a bit difficult to make the proper reconstruction because we don't have enough space. So we would opt in between these two answers. First the full ortho and then the reconstruction, or maybe we can be guided by the Prostho. And more than half of you answered this, and we also opted for this option. Today we are on Instagram, we are live, but after all we are also going to upload this material to our YouTube channel. And I would like to kindly ask you, if you like what we are doing and if you want us to continue, please, you would make us really happy if you subscribed, because I think we share with you guys our daily doubts and our clinical life. And subskrybujesz. Please push the subskrybujesz, okay? Each subskrybujesz will make us very happy. Okay, so let's go back to our patient, our young woman. As I said, she seems almost perfect, okay? There are some issues in her dentition. There are some aesthetical and functional needs, but maybe some years ago, still a few years ago, we would say, well, she's almost perfect. Fortunately, nowadays, we can make her function and her aesthetics really perfect. So what we can see here is that we have a bit narrow arches, both upper and the lower, a bit of negative inclination of the crowns, some irregularity in the incisal margins, and some crowdings, both in the upper and the lower jaw. Apart from that, we can observe a moderate wear, especially here in the canines, it's very visible. But also in another teeth, there are, almost in all the teeth, we have some surfaces that are worn down. Normally, wearing of the teeth can be derived from attrition, abrasion, erosion, but many times in these cases, actually it's a consequence of different interocclusal arrangements. So the interocclusal contacts are a bit pathological when we have the malocclusion, and that's why we have the wear. So now we should ask ourselves, if we want to treat this patient, okay, we can orthodontically align her, but should we also restore the worn down tissue? It doesn't look so bad, right? But what about the stability of the orthodontic treatment? Dr. Elena, she will say, I want it all restored because I want the longevity of my treatment. So still, when we didn't have digital tools, it was always a very difficult task for the orthodontist to design the orthodontical treatment in such a way for having a perfect space for restoration further on. Now, fortunately, we have digital tools and we can design it, everything. We can design the orthodontic treatment prosthodontically guided. This is the PGO, not PGU, sorry, PGO. And guided by Prostho, we can design the ortho setup in such a way for we have perfectly enough space for the missing restorations. So what did we do? Of course, we diagnosed fully the patient. We did the full protocol of the photos, intraoral scanner, a scanner, 3D tomography, and orthodontical department prepared an orthodontic setup, the clean check. What was planned? The approver, not clean check. Ah, okay, it's a brand, okay. The setup, the orthodontical setup. I'm not from ortho department, that's why okay, I go by. So what can you observe? It moves very slowly, but if you pay attention, you will see the movements that are planned. So we have planned the expansion of both the arches, elimination of the crowdings, reduction of the negative inclination of the crowns, and the overall alignment of the teeth. And after the patient accepted the setup, the ortho department accepted the setup, we proceeded with the ortho treatment. It was a pre-prosto orthodontic treatment because already in this phase of the ortho treatment, the department thought about approximately giving some space for the needed restorations. And these are the outcomes of the first phase of orthodontical treatment. As we can see, all the assumptions were met. Okay, we have the alignment, we have the reduction of the negative inclination, and we are ready for the second phase, which will be the restoration. The crowdings are eliminated, and now we have space for making our restoration. So what do we do now? Now we can enter again with our digital tool and we can prepare a digital wax-up. Here with help of Mariana from our YAD lab, we prepare the wax-up. And as you can see, the missing tissue is not a lot. It's actually very little in all of the teeth. The wear was not big. But this will make all the difference in the final outcome of the stability. So now, what kind of reconstruction method would you choose for actually copy-paste this project? In my opinion, the best method here, and this is like the only choice because we want to be minimally invasive, is the reconstruction by injectable flow technique. We are actually, this season is very fashionable in Prostho department, the injection flow technique. we didn't even, talk about it, but it results that we all talk about injection this season. We even call it with Berta the glow injection technique, because actually it gives back the glow to the patient. Okay, so what did we do? Here I used the Filtech Supreme Flow and ExaClear clear silicone to produce the clear silicone tray. And I proceeded as normal. I prepared the two teeth accordingly, and what was the doubt here? Can we actually use the silicone tray without removing the attachments from the teeth? We don't have the need of removing the attachments because we are going to continue with the ortho, so this would make it more complicated. And yes, we can use the silicone tray with the attachments on. It doesn't make anything more difficult, but we have only to always check to not bond the surface of the attachments, because then the cleaning process will be more difficult. So the silicone tray was used here. All the procedure was taken. Then I went to the finishing, the full polishing protocol, and everything seemed perfect. But flow injection is a great technique, but it's not perfect always for everything. Here we can see, as in a 4-class aesthetic restoration in the central incisor, it doesn't look so good, right? because we only use one tone, we only use one color. But this is not a problem. We can still base on the waxed up design and the perfect shape. We use it as a base. We use a window technique here, and we make space for freehand stratification of the composite. And then based on the perfect shape, we can work a bit on the aesthetic to make the restoration less visible. And this is the outcome of the flow injection restoration in all of the teeth, basically in both arches. And now we can see how it looks. The teeth have more anatomical shapes, the cusps are more accentuated, and everything is more aesthetic. So now, also here in the in the side view, you can see how all the cusps are restored, and still we have the attachments, nothing changed. In this moment, we can go to the next step, which is the post-prosto orthodontic treatment. And in this moment, orthodontic department can plan what is missing and what was planned here. We still need some final alignment of the incisors. The central diastema will be still closed, and the intraocclusal contacts will be equilibrated, because as you can imagine, after making the restorations, the contacts, interocclusal contacts, are not perfect. In some places they are too strong, in some places they are too weak. So now the ortho department, based on these shapes, the perfect anatomical shapes, will equilibrate the interocclusal contacts and make it actually a perfect treatment and very minimally invasive. So as a conclusion, this kind of approach, which we could call like a modified PGO approach, gives us some advantages. So the objectives of the treatment can be established early on and can be shown to the patient. We have improved communication between the specialists. We have treatment time reduction, and the precision and predictability of the treatment is higher. So I think this is a nice case to repeat in this kind of needs. Thank you so much for your attention.